Okay, hello everybody. Welcome to our Digital Scholars webinar. This is hosted by the Southern California Clinical and Translational Science Institute, the University of Southern California and Children's Hospital, LA. My name is Eric Peterson. I'm the co-director of Digital Recruitment and Scholarship, also an associate professor here in the Psychiatry Department at USC. So for our talk today, we're going to ask that questions be held into the end, but we also want you to type in your questions as they do come up. So what I'll do is I'll keep track of the Q&A as well as the chat, and I'll ask our speaker those questions at the end, and I can refer back to specific slides if necessary. So we are really excited today to have Jean Chan. She is a Clinicaltrials.gov expert, and she's going to be talking about how to register trials and reporting requirements for Clinicaltrials.gov. Jean serves as the protocol registration and systems administrator in Clinicaltrials.gov for us here at the University of Southern California. And she provides support for account setup and guidance specific to non-cancer studies at USC. So she's got a lot of expertise in this. We're very excited to have her. So I'm going to now turn it over to Jean Chan.
Thank you very much. I appreciate being here. I'm really glad to have the opportunity to talk and share this information and provide resources. I know I deal with people on a day-to-day basis when they have questions. We do have some information on our website for USC, but I know that it can be a very complicated process. There's a lot of resources out there, mostly on the Clinicaltrials.gov site. And you can find it also some information on our website as well. But it's a lot broader than just what I handle, but I'll try to explain in terms of just overall systems and how to register, how to report. And I'll start here. I wanted to get a poll in terms of our audience and wanted to find out sort of who requires registration of a study on Clinicaltrials.gov. I wanted to get sort of your background and kind of get some information from you, what you view as to maybe you've encountered specific agencies asking for this. Let's see, I'm sorry, I have to share this. And so this is, I'm going to launch a poll just pretty much asking who requires registration of a study on Clinicaltrials.gov. And there's a number of agencies here, and I just wanted to get your feedback just to find out your knowledge in terms of what agencies maybe you've encountered that you've worked with that have required this Clinicaltrials.gov registration. Okay, I'm going to give it a few more seconds, waiting for all of our participants to answer. We're almost there. Okay, I'm going to end the poll and see what the results are. Do you see the results? I'm not quite seeing it. So what's coming out is 63% for NIH-C, 29% the FDA, and 8% ICMJE, Journal of Medical Editors. Not a lot have experience with CMS or the World Health Organization, but in fact, all of these organizations have required registration for Clinicaltrials.gov. But certainly the ones that you've listed are the main ones that we've encountered in terms of questions and reasons why most people have to register. The one that's often not mentioned is the International Committee of Journal Medical Editors, and that's one of the main reasons a lot more people that we've seen a bigger influx of registrations. It's mainly just to publish, to be able to publish. A lot of the editors have required over a number of years, although they may not have held to it very strictly, but we've had some recent rejections in publications just because a study hasn't been registered in Clinicaltrials.gov. So we've made a concerted effort. In fact, the IRB, when they're reviewing studies, they are reviewing with that main effort and understanding like potentially this study could be categorized as a clinical trial under ICMJE. And so in the recent years, we've been asking, the IRB mostly has been asking people to register their studies before they submit and get approval. The next poll I wanted to check in with you guys on here. I just wanted to is I wanted to see your experience in terms of registration. So do you have any experience with Clinicaltrials.gov in registering or reporting results on a study? Yes or no? Okay. We're almost there. I'm going to end the poll right now. And we have 63% saying no and 38% saying yes. So I'm glad there's some people that have had the experience, and I'm glad this information is going to be shared with the people that have not had any experience as of yet. And hopefully this could be a good resource and introduction to you. Okay. So the topics that are going to be discussed in this presentation, I'll go over just a brief overview and a background about Clinicaltrials.gov. I'll explain the purpose and benefits of clinical trials registration and results reporting. I'll talk about USC's structure and resources that are available, how to register, just kind of some basics of how to register your study and how to work within that system, how to submit your results in the system, and then just some tips and tricks to meet some of the requirements, a lot of the comments that come up often, and just sort of some workarounds that I've uncovered in terms of questions that come up and things that have to be addressed that we've seen over the years. So just in terms of a system introduction, clinicaltrials.gov, and sometimes I'll use ct.gov just to shorten it, will be used interchangeably just for brevity of the presentation, but the correct internet address is www.clinicaltrials.gov. And this is actually the public site where you would register your study, and it would be a register throughout the nation where the public can access and look for clinical trials, and just look and see what the updates are and types of clinical trials that are out there in recruiting. And even the results that come about from those studies. So there are two basic functions of clinicaltrials.gov. It's the registration, creating the study, and then also updating the record. So you may have to go into that study a number of times in terms of updating, when recruitment happens, when things change within the study, and then also results reporting, which will be required within 1 year of the completion of the study. And then you'll actually enter data reporting results for the study. And then there are two different types of systems that are available. So I just wanted to be clear, we talked about the public site, so the clinicaltrials.gov site that the public accesses, and then also the user site, which is the protocol registration and results system, which most of you will be working in directly, so that you enter the registration of the study and then the study results reporting within that system. So there's two different access points. This is what the public site looks like. And then they could search by condition or disease. They could search by other key terms, maybe the investigator's name, a drug name, if they have a specific number, an NCT number, which is assigned when the study is published and made available online, or they could look by country. And then there's some more details that they could look up in the advanced search. The protocol registration and results system this is the interface that you will see to log in. So the organization name, we'll talk about that a little bit more, but then there's one organization name for USC. So if you are, performing a study at USC, this is our organization name. That stays consistent. And then if you need an account, I would be the person to help create that account for you. You'll have a username, and usually the system will assign you a password. You could go in and you could modify it for your, just for your specific purposes, so you could remember and keep track of. You can always, revise the password if you need help. I can also assist in that regards. So the account maintenance of it, I just skipped it. So this is an overview and some history and background about how the results registration requirements came about. The first law that was in place by Congress in terms of requiring registration was back in 1997. NIH created their own registry, which is now Clinicaltrials.gov website in 2000. And then in 2005, the ICMJE started requiring registration before enrollment. In 2006, the World Health Organization created their own international platform for registration of clinical trials from Clinicaltrials.gov. Now, the World Health Organization has a number of other registry sites to meet their requirements. So there's a number of other international sites but for most of our purposes, what I've been told is clinical trials, is the main interface within the US that we've used. And I don't think we've had a lot of experience on those international platforms, but the clinicaltrials.gov will meet a lot of other federal requirements, specifically if you have federal funding or other sources that will require it specifically. So in 2007, CMS started requiring PIs to enroll qualifying clinical trials in clinicaltrials.gov. And this was based on reimbursements from Medi-Cal and Medicare. So the federal funded programs would require this registration to get reimbursement for those types of patients in 2007. And in that same year, Congress expanded the registration requirements. It's now termed as FDAAA, and they put a lot more meat and detail in terms of the requirements and also penalties that would result of not meeting the registration and report results, reporting study results. Now in 2008, NIH released the results database. So they enhanced the results reporting database a little bit further. And then in 2015 is when CMS started mandating the clinicaltrials.gov number before they can reimburse for claims. And then in that same year of 2015, NCI, National Cancer Institute from the NIH, issued a clinical trials access policy. So it started requiring those cancer studies to require the same registration, although in a different way. And then we'll talk about why maybe some of our structure is also based on that, where we are separated between cancer studies and non-cancer studies. And then in 2016, NIH released their final rule for clinical trials registration and results reporting. And those who already receive NIH funding, you may notice some significant changes over the last few years where they're actually enhancing their systems and requiring more details in terms of these clinical trial registration results. And they're also connecting the NIH systems to clinicaltrials.gov in terms of sharing information between these the data within the two systems. And then in 2017, the most recent requirement is from OHRP. So there was the revised common rule will indicate that the informed consent now has to be, so any federally funded clinical trials will require posting of an informed consent. So if you already have your study registered in clinicaltrials.gov, you will already meet that requirement with the registration already in place. And all you would have to do is download or upload your informed consent onto that site. And then they also have another website that's also an option, but if you're using clinicaltrials.gov, it'll be a simple upload into that system. And reasons to register for clinical trials and results report results is for mainly for human subjects protection. It allows potential participants to find studies. It assists ethical review boards and others to determine appropriateness of studies being reviewed. It promotes fulfillment of ethical responsibilities to human volunteers, that research contributes to the medical knowledge, and also contributes to research integrity. It facilitates tracking of protocol changes. It increases transparency of research enterprise. It mitigates publication and outcome reporting biases. And also for the allocation of resources, it promotes more efficient allocation of research funds. It provides a public record of basic study results in a standardized format. And then in terms of violations and penalties, FDAAA issues pre-notice letters, and they'll provide a 30-day notice to correct. FDAAA notice of non-compliance is then followed if there is no change within those 30 days to correct. So the non-compliance letter would be issued to the responsible party, and then will require correction, and penalty will be noted on the study record. So failure to submit, there's three ways that they'll indicate: either failure to submit required clinical trial information, submission of false or misleading clinical trial information, or failure to submit primary and secondary outcomes. The organization can be fined up to $12,000 per day for each study's non-compliance. Organizations such as FDAAA Trials Tracker publicizes non-compliant agencies, and NIH and CMS will withhold funding or reimbursement for non-compliance. This is an example of one of those websites that publicizes that information, and it was started out. This is more of a UK-based site, but it was from the University of Oxford, and they were just looking, and this information pulls directly from Clinicaltrials.gov. So they publicize this information on their website, and they track, all of the agencies that have accounts, and then they will within their website, it funnels the people who have reported late, and once you've reported late, that status stays. If it's overdue, it'll state that it's overdue. If it's still pending, they'll indicate that it's still pending. So their information downloads from Clinicaltrials.gov, and then they'll make sure to know, and they'll track all of the agencies. Right now we're at 40%. There are a lot. We're kind of in the middle. There's a lot of agencies that are at 190%. So we have a ways to go. We're lucky that we haven't gotten any fines as of yet, but at this stage, they've been beefing up some of these compliance issues and then also getting the systems joining and working together so that this information is they're taking more diligence in terms of tracking and making sure we're notified before these sort of compliance issues come into play. But just hypothetically, if the government had imposed fines, at least we'd be running in the range of 71 million in the hole if that's the case. But hopefully we get these things cleared up, and then these amounts lowered. But I think it's just a way to show that to promote these studies being reported on a timely basis. And why register and report? We want to provide a commitment to our research participants, in terms of scientific validity and transparency, and getting the information out there and responsibly, ethical standards. We want to demonstrate responsible stewardship of federal funds. We want to help the IRB assess values of new studies coming forward. And also, it's also required by law. The FDAAA regulation for journal publication instituted by the ICMJE, and ethical requirements required by the World Health Organization, and a number of other funding agencies. And I'll talk about the NIH, NCI, CMS, and the main agencies, but there are a lot of other federal agencies that contain some of these requirements in their terms. We don't encounter them as often but also like DOD is also another federal agency that would require it, but I don't talk about them too often because it doesn't, it's not a major share of most of our studies, but the rules apply in a similar fashion, and also foundations, private foundations. What clinical trials needs to register and report? So I'm going to go through these questions of the why, what, who, when, and how to help break this down. So what trials need to register and report? The main requirement that started it all was under the FDAAA, and they are requiring clinical trials, applicable clinical trials, which they've defined I'll go over that definition. NIH is also the main agency, and other federal agencies. ICMJE has another definition that I'll go over, and then also the CMS also has their own definition. Okay, so now what are FDAAA applicable clinical trials? And this is the definition under FDA FDAAA regulations. So it'll include drugs or biologics, devices. If the trial has one or more sites in the US, if the trial is conducted under an FDA IND or an IDE application, or the trial involves a drug, biologic, or device that is manufactured in the US or its territories and it's exported for research. So this is the main definition that most people associate with clinical trials under that FDA requirement. Now, NIH has a broader definition for their clinical trials, but it has to be funded by NIH in whole or part. And then it also has to meet 4 requirements to be a clinical trial under the NIH standards. It has to have 1 or more human subjects involved. Subjects are prospectively assigned to 1 or more interventions. The study evaluates an intervention defined as a manipulation of the subject or subject's environment for the purpose of modifying 1 or more health-related biomedical or behavioral processes and or endpoints. So the behavioral is also introduced into this definition, which broadens the definition a little further than FDA. So it could include the normal drugs and biologics and devices, procedures, delivery systems, strategies to exchange health-related behavior, treatment strategies, and then now also it involves prevention strategies and diagnostic strategies. And then also the 4th component of a clinical trial from NIH is that the study evaluates the effects of those interventions on health-related biomedical or behavioral outcomes. And I provided the links. So once this presentation is made available, if you ever need to go and access that information to check if your study falls under any of these definitions, the links will be provided here. And then under ICMJE's clinical trial definition, they say that any research study that prospectively assigns human participants or groups of humans to 1 or more health-related intervention to evaluate the effects on the health outcomes is subject to registration. So their definition involves the health-related intervention similar to NIH, but also they have purely observational studies included in their definition. And then, so if there's any questions, they also, they indicate you should consult with the editorial office if you're not sure if your study would qualify as a clinical trial. And then the resource here is available if you ever need to access that. And then for CMS, the clinical trials definition is a qualifying clinical trial that will render claims for items and services to the Centers for Medicare and Medicaid Services under 3 policies. So they'll have a clinical trial policy, the investigational device exemption policy, and a coverage with evidence development. And then, so they will require the NCT number. It's required for claims for items, services that qualify for coverage under Medicare National Coverage Determination. And, you know, the resource documents are also available if you need to access those. Okay, and then what other federal agencies or sponsored clinical trials would be subject to these requirements? And then I had mentioned earlier, OHRP, the Office of Human Research Protection. It was issued under the revised common rule. It requires all clinical trials supported by a federal agency to post on a publicly available website the IRB approved informed consent within 60 days of the last visit. The award terms and guidelines should be followed for all other study-specific trials supported by other external funding sources. So that's sort of a catch-all. If you receive funding sources and your contracting agency requires posting and registration on clinicaltrials.gov, that will be on a case-by-case basis as well. And then, so these are the regulations. Just broken down by entity, the registration requirements. So you'll see that each agency is, you know, it may vary in their requirements. FDA and NIH will require registration within the first 21 days of enrollment, whereas some of the other agencies may not have a specific timeline. The biggest difference here is the 21 days within enrollment of your first participant, and then ICMJE indicates prior to enrollment. So those are the biggest differences between the two, between the agencies. But if you know, if in doubt, I guess to be on the safe side, you want to register prior to enrollment to meet all sort of publication requirements. And then also the results reporting in some of the areas are spotty. Now, ICMJE doesn't necessarily require results reporting, they just require the registration. But the FDA, NIH, other federal agencies are going to require the results reporting. And also, once you enter the study in the system, it's going to read as a voluntary submission of results reporting. So it will naturally automatically generate an error past the 1 year mark. And then you can see that there's the various penalties that can be applied if we don't meet those results reporting requirements. And which we mentioned earlier, which is the fines, which could be 12,000 study per day. And then loss of funding or withholding of funding, or they may not issue the next year of funding for some of those these other agencies, these other federal agencies. ICMJ may reject your manuscript and your study may not be eligible for publication. So those are the penalties for all of the different agencies. And then the who do you contact at USC? So I had mentioned earlier that USC splits out the responsibility areas in terms of, we have two different groups within Clinicaltrials.gov registrations. We have cancer studies and non-cancer studies. And there is an office, the Clinical Investigation Support Office supports those cancer studies. So once it qualifies, once it's submitted, to Zeno Ashai, the associate director. Once they've determined that it meets the requirements for the cancer studies, they internally track that data within their internal system. And then they actually have administrative support to put all of that data within the system and then and export it into clinicaltrials.gov. And Victoria Soto is the regulatory administrator. So she's the main person that interfaces with clinicaltrials.gov. I am responsible at PRS for the non-cancer studies, and we are set up a little bit different, and I'll explain that a little bit later, how the differences are between the two groups. But I am the PRS administrator in terms of setting up accounts and helping in terms of the process, but we don't necessarily have the direct same administrative support that the cancer studies have. So a lot of the responsibility will be working with the PI and also their support staff as well. So who is the responsible party? So FDAAA refers to the responsible party as the entity or an individual who is responsible for registering a clinical investigation and submitting clinical trial information to the Clinical Trial Registry Databank. The statute is defined here, but mainly it's the sponsor or the PI who will be responsible for the study. They'll be responsible for conducting the trial. They have access and control over the data from the clinical trial. They have the right to publish the results of the trial, and they have the ability to meet all of the requirements under this subsection for the submission of clinical trial information. So, so for investigator-initiated studies, for cancer studies, USC serves as that sponsor, as the grantee of the award. Sorry about that. I want to go back. And then for non-cancer studies, USC delegates the role of responsibility to the faculty principal investigator. So this will be listed in the responsible party area of that clinical trial information. There will be a difference to distinguish sponsor as USC as the awardee for the cancer studies. And then for non-cancer studies, the PI will be listed as that responsible party. That way they have a little bit more control to approve and release the study record. This for sponsor initiated studies, if there's a drug or device that's involved, usually the IND/IDE holder or the industry partner serves as the sponsor and the responsible party in that regards. But they do have the ability to delegate to a PI, but that PI would have to have ability to have all of the data among all of the sites and be able to report all of that information. And then also for multi-site studies, it's usually the lead institution or the contract research organization who would serve as the sponsor and the responsible party in most cases. Now, when to register? ICMJE registry requires it before the first patient enrollment. I had mentioned this earlier. And then for FDAAA, the responsible party for an applicable clinical trial must submit required clinical trial information through the protocol registration system no later than 21 days after enrollment of the first participant. And so when to update the study? While the study is in process, responsible parties must update their study records within 30 days of a change to recruitment status, to a completion date, a change to review board status or an individual site. And then also the record verification date must be updated at least every 12 months, even if there's no changes to the study. So they want to see some type of activity on an annual basis if nothing changes within that study record. Otherwise, it'll pop up, it'll automatically pop up as a warning or an error that comes up just based on that record verification date, the last time you entered that study. And then also the actual end dates need to be updated when it's completed, terminated, or the results are entered, approved, and posted. And then when to respond to comments, registration, and while the study is in process, you'll need to respond to PRS comments to correct errors and deficiencies and or inconsistencies within 15 calendar days. And then during the results reporting process, you'll need to respond to the PRS comments within 25 calendar days. So that's a rule that they'll actually put a deadline. Once you've approved and released your study, it'll go to PRS review. I'll go through that process, and then I'll indicate to you just when that process happens, when they come back to you and ask for changes. This is when they would expect return of these changes or any questions to come up within the 15 or 25 calendar days. And then when to submit results. It's no later than 12 months after your primary completion date. So it'll be based on the primary completion date that you enter into that system. And then it'll calculate 12 months after that. And after that, that's when it will generate an error that you're late if it's past the 12 months after your primary completion date. Okay. And then how long does it take to register a trial? Clinicaltrials.gov estimates it could take up to 10 hours just to enter all of the data and submit submit within the system. And then also, how long does it take to submit basic results? Clinicaltrials.gov estimates about 50 hours. And it really depends on how detailed your study is set up. The results table must conform to study design entered at registration. So it's just, it depends on how you set up the study at registration is how you're going to directly report the results the way that it was set up during your registration period. You may need statistical assistance, and clinicaltrials.gov may also assist if it's needed as well. You can schedule time with them. If usually we've done that in the past. If they come back with comments and you don't quite, sometimes it goes back and forth, some of the changes, and if you still don't quite understand what their comments are, you can set up a conference call with them and they could go over in detail some of those comments. Additional time may be required to address PRS comments, as I mentioned. And then for how do you register? So cancer studies, the CISO will upload an XML file from their internal systems, and then they're going to update and manage the study through clinicaltrials.gov. They'll have the administrative support to register and then update all of the information throughout the study, throughout the time that the study is in place. And then also the reporting of results, they'll work with you to get all of that data to report in the system. Now for non-cancer studies, you would need to obtain a PRS account for all individuals requiring access to the records. So the faculty PI will serve as that owner of the record, and then they can give access to whoever else they need. Maybe you have a study coordinator that may be entering the data and managing the updates. So you may want to add them to the access list. But the faculty PI will always serve as that approver at the end to approve and release. So once whoever else completes and updates the data, they'll enter complete, and then it gets routed to whoever the listed responsible party. So you'll want to make sure you list the faculty PI because they'll be the ones to approve, and then they also release the record. And then this is just a question that often comes up for those non-cancer trials is what's the organization's unique protocol ID? There are no hard and fast rules. Some PIs may manage a number of studies and they may have their own unique name so that they could identify it. But in most cases, your IRB application ID can serve as this unique protocol ID. And then also when you're registering, just be sure to know that, the asterisks and the asterisk sections marked are required entries. There's a number of guided tutorials and reference definitions. And then also, this is also a quality control review criteria that they go by. So this is also helpful information. Oftentimes that people ask me questions of how to enter data, I will walk them through these resources on the clinical trials site. And then also, I mean, if you read through some of these definitions, it'll explicitly tell you how to enter the information and what data that they're looking for. Okay, and then NIH, the NIH system that interacts with clinicaltrials.gov are connecting now. So the NIH Assist system, which houses their human subjects system, their form for the details of the participants are connecting in terms of, they validate information, and then also the outcome information section is also syncing up to just coordinate the information and make sure that it's consistent. So this is from the human subject system in Assist, and then they'll ask for the clinicaltrials.gov number. So this is just an example what it looks like where they ask for that information. These are also other fields that connect. within the HHS, the NIH system, and then also Clinicaltrials.gov. So although it's named a little bit different, but for the most part, the title, the conditions, primary disease or condition, similar, all eligibility, age limits, recruitment. So, pretty much these are the data fields that match up within, and then make sure that the information is consistent. Now, if it's inconsistent, we've been getting a lot of inquiries from the NIH GMS coming back to us to correct these, to make sure that both systems have the same data. And then there is also a way to export data from NIH HHS system to clinicaltrials.gov. So this is what the screen will look like in terms of requesting to export the information from NIH Assist into clinicaltrials.gov. And then once you try to export that information in HHS, you'll go into PRS, you'll upload the record as an XML file. And then it'll move the data into clinicaltrials.gov, and then this is what it'll look like on a successful submission. You'll still have errors, but the coordinating fields that match up will export that data, but you'll still need to enter the rest of and make sure all of the information is complete before you submit in clinicaltrials.gov. Yep, so HSS-PRS registration tips and tricks. You'll just make sure the anticipated dates will be in the future. The actual dates may not be in the future, and do not change to actual. Don't change the actual dates just to pass the validation, because it will require your PO to go in and revise it if that's the case. So you'll need to make sure that your actual anticipated dates and actual dates are accurate. And then before you approve and release the record, you could check for spelling errors, and there is a feature in that system to do that. And then also you want to make sure any acronyms you want to expand and spell out. And then check all outcome measures for accuracy and completeness. Any errors or warnings, so there'll be warnings and errors noted, and then you'll want to be able to go in there and then see what the error reads as to correct these before you submit. And then how long does the NCT number is received, and how long until the NCT number is received and it's publicly posted. So once the responsible party approves and releases the study, it'll take about 2 to 5 days for clinicaltrials.gov PRS review. Now, if they have comments back to you, you'll have to watch for that study and check back, on a weekly basis. Depends on how quickly you want this. But maybe on a weekly basis, you should probably check the system to see if the comments have come, if there are any comments have come back, or if it's moved forward. If there are no comments, then NCT number will be assigned. That will take another 2 to 5 days for the study record to be published in clinicaltrials.gov. So hopefully, if there are no issues, the quickest turnaround could be a week to 2 weeks. But if there are comments, it's going to wait for you to address those comments before it goes through that process for posting. And how to submit results, scientific information. These are the fields that are required in the submission of the results. So it's going to be per arm. That's going to ask for you to the participant flow. You're going to have to put in the number of participants that started and completed. And then these are the mandatory baseline characteristics of your participants: the number of participants, age, sex, gender, race, and ethnicity. And where the information is optional, it's regional, region of enrollment, and then also the education. And then also they'll ask for outcome measures. They're going to ask for number of participants analyzed. They're going to ask for the title for each of the outcome measures, a description, You're going to assign a measurement and there may be statistical analysis that's needed as well for each of the arms. They're going to ask for adverse events, any serious or other types of adverse events, limitations and caveats, other administrative information, which could be the results, point of contact, and any sort of agreements that you have that you want to upload and provide. And then these are resources that'll give you some more information about submitting your results. There's a webinars, there's also hints available. And then these are the most common PRS comments that have come back. That usually those ask to remove the personal pronouns. They'll ask you to identify the intervention descriptions a little bit more clearly. They'll provide, this is the expansion of acronyms and abbreviations, and then also like spelling errors. The time frame, it's not specific, so they'll ask you for more specifics in the time frame. The outcome measure describes multiple assessments with potential different units of measure. So they'll want to make sure that you use a consistent unit of measure. And then also the outcome measure title is vague, so they'll ask for a little bit more specificity in that regard. So tips to prevent common errors for entering basic results. Just make sure your enrollment numbers in the protocol section does not conflict with the number of participants started in the participant flow. Use the ARM group description to provide additional details from the interventions administered. Expand acronyms, abbreviations for the first time used. Use the spelling feature. The outcome measure should be specific, measurable by units of measure provided. Ensure the number of participants analyzed is consistent with the numbers provided in any of the rows in the participant flow module. Provide a brief but descriptive summary of the criteria used for the outcome measurement assessment. And this is just an example. And then the website will also give you a number of examples based on your study type as well. They'll have a lot of details in terms of the study type. Measure title description. This is for number of adverse events, and the units of measures of participants with adverse events are inconsistent. So you want to make sure they're consistent. The time frame provided is not specific. Those are other common errors. Previous comments have not been addressed, so sometimes it's non-responsive. But if you're not sure what the comment is asking, maybe it can call for a question back to Clinicaltrials.gov or setting up of a meeting. Provide a brief but informative ARM group title. And then in terms of violations, we briefly talked about the process of the violations, but they'll issue a notice of non-compliance to the responsible party. So you'll have to remember for the non-cancer studies, the notice of non-compliance gets issued to the responsible party, and it's going to be going to the PI, the faculty PI. So the organization USC will not get notified. So it'll be important for the PI receiving such a notice to either let me know, the PRS administrator, or also the Office of Compliance. I could connect you to the Office of Compliance if you need assistance. And then also, the National Library of Medicine is required by FDAAA 801 to add information to a study record about the violation. So in Clinicaltrials.gov, it'll note that the record is late in terms of results submission. So it'll show up on that Clinicaltrials.gov record. And then we talked about the 3 categories that can be listed in terms of the 3 types of violations that you may receive. And then also the responsible party is getting that letter. And then pre-notice letters are not identified as violations. So we talked about, you get a pre-notice letter, and then you have 30 days to correct, and then the notice of non-compliance comes about after a warning letter. So that's the pre-notice letter for 30 days, and then notice of non-compliance. You have another 30 days to correct. Otherwise, the correction of penalty is noted on the record. And then this is just an example. There's 3 letters issued so far this year to private industry. There was one recently in the last couple of months to a doctor, and he was not yet associated with a organization. But this is something that we're looking into to see if it was really just a private practice doctor, or if there was an institution involved. And then this is an example of one that's received by Acceleron of a notice of non-compliance. And that's about it. I wanted to thank you for your time. Hopefully this information was helpful to you. If you have any more questions, you're welcome to ask. The cancer studies are split up between Victoria Soto in CISO, and then I manage the accounts in the non-cancer studies, but I'm more than willing to help in terms of guiding you through the process or connecting to the right resources. And also I've provided the additional technical and scientific support where we can set up meetings with Clinicaltrials.gov if there are very specific questions for your study record and in terms of making corrections.
Great, thank you so much, Jean. That was great. We had a lot of interest, a lot of people in attendance, so we really appreciate you sharing this with us. So just got a couple questions, if you just got a few minutes to answer a few. I think some of these are just some clarification questions, but also wanted to refer everybody to the chat where we put in most of the links. This presentation is also going to be available on our website, and I'll post that in just a minute, in probably about a week or so. So Jean, I just wanted to clarify, when you're indicating the responsible party, so is the responsible party is it ever going to be the principal investigator, or is it always the sponsor?
So it depends on if it's a cancer study or a non-cancer study. So the cancer studies, the responsible party is going to be the sponsor, the awardee, USC is going to be listed. For the non-cancer studies, we are delegating it to the faculty PI. So it's going to be the faculty PI being the responsible party. That's going to be listed on that record.
Gotcha. And so that's internal, that's, I guess, an institution decision, not, okay.
Correct.
Gotcha.
Yeah, it changes per institution. Yeah.
Okay, so something to check with your institution, who should be the responsible party there. Okay, another question, somebody's asking for clarification. So they say we cannot enroll anyone until the study is public, correct? And we cannot post the study until it's officially approved by IRB.
That is not correct. So we talked about when to register a study, and it depends on who's requiring it. So if you're doing it for publication purposes, the ICMJE requires it registration prior to enrollment. And then for NIH purposes or for FDA purposes, they allow you to register within 21 days of your first enrollment.
Great, thank you. I guess just one more. I think you've answered all these. Is there a way, so I know that you enter information and then they'll send you back an email or within the system tell you what you need to change, but is there a way to reach out to PRS for a conference call to actually talk with somebody?
Yes, definitely. So the email that I listed here at the very bottom, register at clinicaltrials.gov. If there's a very specific question to your study, you could ask them directly. If it's very general, perhaps, I could be your first resource in terms of if there's something available on the website or if there's some type of standard practice that we do at USC. But if it's something that gets very study specific and very technical within your study, then that might require like some consultation with clinicaltrials.gov, and you can definitely set up a meeting with them, or you could ask them directly as well. Great.
And just, from my own experience registering trials, they actually are pretty helpful when you do get a hold of them, either by email or by calling. Okay, just want to thank Jean very much again for this presentation. Just so you know, this will be posted in about a week. I just put the link in the chat, and right above that link, you'll see a link to a very brief survey just to let us know, just to give us some feedback on this specific talk, but then also just for any interest in talks that you'd be interested in us hosting in the future. We do have our November 3rd talk already scheduled. This is going to be Dr. Allison Booth. She's going to talk about an overview of Prospero and the mechanics of registration of systematic reviews. And Dr. Booth is at the Center for Reviews and Dissemination at the University of York. So it's going to be a good one, November 3rd at noon Pacific time. So please look for an announcement about that. And with that, I will end the webinar. And thank you again, Jean, and thank you everybody for attending.
Thank you. Good luck, everybody.